Welcome to this webinar then, everyone. This is one of the regular webinars we do around some of the issues that face us in the 21st century, but we're doing this one in the daytime, which means we don't have as many people on, but we will disseminate this out to a wide audience through our YouTube channel, through our social networks, and Social Action for Health, who we're doing this webinar with, will do the same as well. So we should get a lot of people to see what's a really interesting initiative that they have. What we're going to look at in this webinar is the work that Social Action for Health does in improving the well-being of people in their area, and particularly in the area of dealing and tackling with obesity, because Hackney, like many areas, is what's called an obesogenic environment. That's an environment where it's very difficult to change your lifestyle because there are so many barriers in the way. Barriers like, huge number of fast food outlets, not enough places necessary to exercise, people in a hectic job so they don't have time to think about cooking and eating healthily, and they're buying fast foods. Now, how do you tackle that? And Social Action for Health has a whole program that looks how they've done that. So we're going to talk to Adam Wilson, who is from Social Action for Health and who's been working on that. And then we also have a short 6 or 7 minute interview from one of the clients who they work with, who's gone through the program, who's gone through the problems, and is going to tell in his own words his own story. And that's really worth listening to. And then we'll come back to Adam as well. So while Adam's speaking, please feel free to type up any comments you've got or any questions in the chat box, and we'll take that up with Adam once he's finished his presentation. Okay, Adam, so over to you, and thanks for joining us.
If I start off just by talking a little bit about the obesogenic environment. So there are a number of factors which ultimately contribute to people putting on weight. So essentially, the term obesogenic environment refers to all the lifestyle, social, and environmental factors which people face, which have made it conducive to actually becoming obese. So if you look at the UK figures, 63% of adults are classed as overweight or obese. The project I'm involved with in Hackney, the adult obesity epidemic, is about 41%. So why is that? Well, essentially, people are a lot more sedentary than going back 10, 20 years ago. So increase in sedentary behaviour. So people are essentially working longer hours now. There's a longer working week. People are stressed. People have deadlines to adhere to. Even though people are aware of the need to exercise, and there's a lot of promotion from government and local councils on that, there's an increased exposure to artificial light. So what do I mean by that? So there's increased television viewing hours. I think now if you look at the average household, pretty much every household within the UK has a television set. I think pretty much 1 in 3 households have 3 television sets or more. And with that as well, you have increased number of people using social media such as Snapchat, Facebook, LinkedIn, Twitter. So increased exposure to artificial light is more sedentary behaviour. That transfers to sleep deprivation. So generally, the average UK adult sleeps for about 6 hours or less. And this in itself is quite negative, because if you're not getting sufficient sleep, that can disrupt your hormones. You get an increase in stress hormone, certain gut hormones, which makes you want to eat more, particularly calorific, energy-dense foods. So I think now if we talk about foods, what you said about the number of takeaway shops, that's actually quite telling. I'll talk about this in our campaign very shortly, but there are a vast number of takeaway shops, not just in the UK, but particularly in East London, in socially deprived areas such as Hackney, Tower Hamlets, Newham, in conjunction with the number of takeaway shops within the borough. What you tend to find now is a lot more food is processed. So a lot of the foods that we find are not overly nutritionally good sources of food. They tend to contain a lot of fats, excess calories, a lot of salt and a lot of sugar, which ultimately is not particularly good for our waistline, as you can imagine. I think now as well, I mean, I could go on about this all day, but fad diets as well. There's a lot of mixed messages from the media, and particularly now with the increase in fad diets and people trying to resort to a healthy lifestyle, trying to eat in a certain way, which is not always necessarily healthy and can actually make people put on weight. If I think about one specific example, there was one, I'm not going to name the manufacturer, but you supplement your daily eating routine with protein shakes. And what they tend to find is people actually put on more weight afterwards, because it doesn't teach people about calorie control and particularly eating certain macronutrients like the right amount of protein, like the right amount of carbohydrates or fats. So I think particularly with the obesogenic environment, people face a number of barriers. Mental health is a big one, particularly in Hackney. And if people have poor mental health, they don't have the right coping resources, that can underpin poor eating behaviour. I'll talk to you a little bit more about that as we go on as one of our campaigns. Culture is a huge factor. If we look at some parts of Hackney or East London, you get vast Bangladeshi, Indian communities, Vietnamese, Turkish communities, and the food can be quite calorific, quite calorie dense. And financial is also a big commitment when it comes to eating healthily on a budget as well. So that's the obesogenic environment, and there's some of the barriers that people face in terms of trying to eat well or exercise.
So thank you for that first initial, overview of what the people face when they're having to deal with their lifestyles. Now, we actually talked to one person who Social Action for Health has been working with, and he told us about the problems that he went through and having to tackle his own lifestyle. And it's really worth listening to him. So let's listen to him now. Hello, I'm Francis Cecilia from GlobalNet 21, and in this interview we're going to look at the problem of obesity. Now, that is a real problem in our society, as many people find it difficult to have a healthy lifestyle, partly because of the environment they're in, partly because of the jobs they do, which make it difficult. Now, in this interview, we listen to John Hanna, who is a care worker, and that is a particular job that makes it difficult to have a regime that allows you to have a healthy lifestyle. Let's listen to what John says.
I'm a caregiver, so by doing this, I have different times and different shifts that sometimes do not allow me to have a follow-up and to put my things in order. So my food goes, either I stay many hours without eating and then suddenly I burst into food. And there are some other times that I'm doing nothing and I'm still eating, and I cannot have a program to cook well and as well to look after a more healthy diet and do more exercises. When you eat late at night, it's terribly unhealthy, exactly. Also, sometimes I wake up very early, say around 4 o'clock. So also, I'm not able to have a proper breakfast. And then I resort to street food or junk food because it's always easy to carry. But the problem is the time and work and different hours, and also the temptation and cost. Temptation because there are so many fast food places and easy food to get. However, the good food is more expensive, I noticed here in the East End rather than the West End. If you see at organic products, which help you to lose weight and maintain a healthy balance, they're quite expensive. When you have a daily life which is demanding in hours and time and transportation, in order to follow your health, it's not always easy. You always postpone it. And I used to postpone things, I have to admit.
So clearly, this was becoming a problem for John, and it was making his life increasingly difficult. But John was a determined person and wanted to do something about it, and he did. He began to reshape his life. And let's listen how he began to do that and what made him do it.
I have noticed that I became not always cheerful, not always interested in doing many things, because when you are tired and you eat various kinds of food, it produces, as I know, toxins in the body. So my mood was changing. My interests in various things in life were becoming less and less. And finally, I was discussing this with a health coach in the short podcast, and she helped me to join those areas that help provide me cooking lessons and doing some exercises. And the main thing is that I woke up one day and I found some people who are much older than me. They were more swift than me and more quick when they were walking and going up the stairs. And this made me hear the bells, let's say, of idleness and fear of any sickness. By learning how to cook and even how to cut an onion, I have to admit I never knew how to cut an onion. I used to crash it. So now I know how to cook it properly. And this is thanks to Bachelor of Taste, as I mentioned before. And by learning how to cut those small little things that I always hated to touch, it made me more interested and actually to enjoy it. And it became sort of a hobby to discuss these things with friends and people. So lately I noticed a change in my way of living and eating. The fast food, I stopped it because I looked also scientifically, as I was advised, about the products used, the oil. Often, I have to admit, I used to have stomachache and headaches. So, because of the ingredients, I have to say they are used and reused. I set out for myself a target. So usually I put on my wall those stick notes and I write a few words and with a plan. So I follow a plan and I say, by next week I have to do this and this. I admit I'm an organized person, so usually I write down what I want. So this helps me also to write what food I want to cook, and which most of them I learned in my cooking classes. And now I take my food with me to work. It's not easy. I have to push myself, but I'm determined to make it.
So John began to change his life, and he did that successfully. But he didn't do it on his own. He found other people who had similar problems, and he found it useful to talk to them. He also had help from a local charity, but he also went to Social Action for Health, and they helped him and they encouraged him. So how did they do that, and what did they do to help John?
Helped me to meet other people with the same interest, with the same determination. It also gave me the ability to act and see and study the factors that are deterring people to lead a healthy life. We were making studies, on the ground studies, in various parts of the borough, where there is a lot of junk food, where we noticed how students go, people, cyclists, some of them are obese, I have to admit. So by making a study and a follow-up, and as I said before, I like to follow things scientifically, this helped me more. So this is what really helped me from the Social Action for Health. And it gave me also the motive to promote it, to help others, and to see, following studies, how it can be changed and how we can affect the local community by promoting various actions. I feel a lot better, and I have to say sometimes I feel proud a little bit because I'm now moving more swiftly. I still have, I'm in the beginning of the road. And I have to admit, it makes me feel more cheerful when I know there is a goal that will lead me to a better and a healthier situation. But it helps to discuss it with others and to keep it followed by somebody else. When you're on your own, you drop it. So sometimes I like to be, let's say, encourage or discuss it or share it. And this is what's happening now.
The PowerPoint, the project I'm going to talk to you about is Does Hackney Make You Fat?, which is part of Social Action for Health. This particular project is aimed at people who know firsthand campaigning to make Hackney an easier place to be a healthy weight. And what that means is people with a personal journey of struggling to maintain a healthy weight who are at the very forefront of this campaign. So it's a campaign for local people who have that personal journey, and those involved are called activists. So the activists take an active role by developing their own solutions to reversing the obesity epidemic, and it's based upon the personal barriers that they face. So, for example, we have a couple of activists who have mental health issues, and they felt that's underpinned poor eating behaviours, such as eating too much sugar, or overeating, or skipping meals and then binging on foods. John, who you saw earlier, his personal barrier was based upon his working hours and working shift patterns. And in order to sort of develop their own campaigns, they actually receive training through a series of activist development workshops, which focuses on the obesogenic environment. We've talked about how to structure a successful campaign. We've looked at other campaigns, for example, Brexit, or Donald Trump's presidential campaign, or Jamie Oliver's sugar tax campaign, and evaluated that to give them the tools to go out there and work independently or as part of a team to tackle obesity. So if you talk about the early beginnings of the project, we actually went live in April, and the project is actually being funded to April 2018. And the funding is from the Healthier Hackney Fund, which is a £30,000 fund from the Hackney Council, which is designed to enable communities to come up with their own solutions to improving health outcomes. So one of the first campaigns that we focused on was actually incorporating the local parks. So this is quite interesting because Hackney has over 280 hectares of parkland, gardens and open space. But we was keen to explore whether the overweight and obese demographic of Hackney, which stands at 41% of adults and 49% for children, were actually making use of those parks. So in total, we went into London Fields and counted the number of overweight people, and we actually found that 477 people were slim, compared to 21 people who are actually overweight or obese, which is quite shocking. The same applied to Clissold Park actually as well. 94% of the total demographic of park users appeared as fit or slim, compared to 6% who are actually overweight or obese. So once again, I think the exact figures of that for 592 people who were slim compared to 37 people who are overweight or obese. So what we did, we actually launched a couple of events within the park. This is actually a picture from London Fields. And these are some pictures across our two events in London Fields and Clissold Park, where essentially we engaged with the local community. We advertised it through a website called Eventbrite. And the idea was that people come along, bring their own picnic, play a range of games such as frisbee, table tennis, football. And the idea was to really empower local people who are overweight, so regardless of their physical stature and size, to use the parks. So in accordance with our park event, we actually put out a questionnaire, and I think only about 15 people answered it in total. And we attained the questionnaire results by going to local libraries, banks, job centres in the borough, and asking 6 questions in total. So I'm not going to give you the answer for every single question on here, but I'm aware of the time. But we asked, are exercise classes in the parks welcoming? And actually only 31% of people said yes. 1% said no, 38% said unsure. So we believe that the exercise classes may be a barrier in themselves to people utilising the local parks. Another barrier was the outdoor gyms, which is essentially, as the name suggests, a gym which is comprised of metal, it's robust, weatherproof, has equipment to allow people to exercise outside. 69% agreed that the outdoor gyms were appealing, but 23% were unsure. So our final question for this, in order to try and ascertain why overweight and obese people were not using the parks, well, we had a range of different answers. Although some stated lack of motivation, unsure, as the highest percentage, some people felt that the overweight and obese residents in Hackney felt unwelcome, the fact the parks are possibly overcrowded, lack of suitable equipment, and even not enough specific exercise classes, which actually dissuaded them from utilising the parks. So some of the solutions that we come up with and are going to present to Hackney Council is to have less intimidating outdoor gyms. So the picture you see on the left is actually from London Fields. And what is quite telling is it just comprises of bars for people to do pull-ups or dips utilising their own body weight. The picture on the right is actually an outdoor gym from Cumbria. And the picture on the right, you might recognise the actual equipment. If you've actually used gyms before, you have things like bikes, cross trainers, and treadmills, which are more user-friendly. So this could be an option to have less intimidating outdoor gyms, which were not aimed at advanced fitness levels. Going on from that, fat-friendly exercise classes. So this is an idea we came up with, to have exercise classes run by overweight people for the overweight community, to really empower overweight people to utilise not only the parks but exercise classes, a more varied exercise timetable. So rather than having such advanced classes like kickboxing or martial arts, we have more things like aerobics or bodyweight exercise classes, less intimidating, and even a fitness buddy scheme. And with the fitness buddy scheme, it's almost like online dating, where people could partner themselves up online with someone else who's willing to exercise, who's perhaps not at advanced fitness level. Our second campaign focused on the food prices in the borough. So we actually went to 5 different streets, as you can see there, and we actually made a tally of all the food prices aimed at £8 or more. Well, we made a list of all the different food prices, and what we found was Broadway markets, Stoke Newington Church Street specifically, had a higher percentage of food items which are over £8 or more. We class this as expensive. In Richmond Road in Haggerston, 89% of the food items that we surveyed were £8 or more, which is quite shocking. And this is actually all the food items from restaurants and cafes within the borough. So as part of our campaign, what we did, we wrote to local supermarkets and asked, actually, a lot of people are being priced out of eating healthily, and that was based on the research we did, where we found supermarket food prices have actually gone up 2.3% since the beginning of the year. We asked the supermarkets whether they'd be A, willing to cap certain food prices, B, whether food prices can even be reduced for staple foods like milk, bread, cereal, and what's actually being done with excess waste. Perhaps not so surprising, not one supermarket in the borough responded, which is quite shocking, and that was despite even our campaign phoning them up to ascertain why and to ask to speak to the manager directly. We also organised a public demonstration, which started here at Social Action for Health, and that was a march to Stoke Newington Town Hall to raise awareness of the food price in the borough and how it impacts upon people's food choices. We also put out a survey on the website SurveyMonkey, and it was 6 questions in total. One of the questions we asked was should there be a cap on how much cafes, market stalls and restaurants should charge for food items? 50% said maybe, and 28% said yes, that people are actually being exploited. One of the other questions we asked as well is that do people actually feel priced out of eating healthily? And did therefore they actually choose unhealthy, cheaper food items from the local supermarket, such as from the frozen food aisle? And 40% of people actually said yes, they were actually being priced out of eating healthily. And that itself created a barrier for people to eat well on a budget. So one of the solutions that we came up with was pay what you can, cafes and pop-up pubs. I'm under no illusion that this might be quite difficult to implement, but with the backing from Hackney Council, we hope that having a pay what you can cafe, where as the name suggests, people pay what they can for food items, can reduce the social stigma of using food banks, using takeaways or opting for unhealthy food items in supermarkets to curb the obesity epidemic. A campaign we've got underway at the moment is a campaign against a number of takeaway shops within the borough. We actually went to a number of roads in the borough and actually counted the number of takeaway shops. So this is perhaps not surprising to some that live in the borough, but this is quite shocking. In Kingsland Road alone, there were 13 takeaway shops, Mayor Street 12, Stoke Newington 9. In total, this works out 9.8 takeaway shops per street within the borough. So what do we plan to do about it? Does Hackney make the facts? We actually put out a petition on a website called 38 Degrees, where we're trying to achieve 100 signatures to help put a block on any more takeaway shops being planned within the local borough. And the idea is to give that to the Mayor of Hackney, Philip Glanville, personally. We've emailed local councillors and MPs. Not a single councillor of 20 that we wrote to responded. However, our local MPs were quite responsive. Meg Hillier, MP for Hackney South and Shoreditch, said she didn't want to sign our petition. However, she would be willing to raise the issue in Parliament and to put a block on any more takeaway shops being built within a particular street. We did hear from the office of Diane Abbott, and we actually tried to invite her to our local community lunch. Unfortunately, she wasn't unable to attend, but we was quite pleased to actually receive a response from our local MPs, which was a sign that the takeaway shop campaign was actually developing traction. So we organised a community lunch, and with the community lunch, which was aimed to protest against a number of takeaway shops, where it wasn't a cookery workshop, but we gave people a homemade vegetable curry, and the idea being to empower people to cook using fresh ingredients. And what was quite telling with this as well, with 11 people that turned up for the community lunch, it came to a total of £16.66. So under £17 to feed 11 people. And with that, we had our partners make kits who provide fresh, healthy recipe kits, give a talk on the day to promote their project, where they provide recipe kits and fresh ingredients delivered to your door, and a free, I emphasise the word free, 6-week subscription to those on low incomes. One of our other partners, the Sugar Smart campaign, also gave a talk at our community lunch, really to sort of raise awareness about the amount of sugar that goes into our foods, and in particular takeaways. As part of our takeaway shop petition, we're actually hoping to work with schools in the borough as well. So this is our petition that we put out there on 38 Degrees. We've achieved 22 signatures thus far, although the petition is still underway. And this is actually one of the pictures from our community lunch here at Social Action for Health. So this is a really interesting campaign we got going, running at the moment, called Weight on My Mind. And basically the idea being is to explore the link between obesity and mental health. So it's based on the notion that we believe that obesity can be underpinned by poor mental health, such as depression, anxiety, trauma, suicidal ideation, as opposed to stereotypical reasons like lack of discipline or laziness. So in order to get this campaign underway, we actually linked with City and Hackney Mind, their recovery hub, which is based near Homerton Hospital. We attended a group discussion where there are 12 participants in total, and as well as a group discussion, we asked the individuals, the service users, to fill out a questionnaire. So of the 12 people in attendance on the day, 8 people agreed to fill out the questionnaire. 5 out of 8 agreed that mental health affected their food choices. 5 out of 8 also agreed that they ate more when their mood was low. So this is one of the questions on the questionnaire we gave them. It's quite shocking. So you see the different segments of the pie chart there. Well, 50% said yes, my mental health makes it difficult to stick to a healthy weight or diet. 25% said yes, they could actually have more sugary foods as a result of their mental health. The 12% said there's no balance, whilst 13% said they overeat or miss meals. But what's telling here is that 100% actually said yes, mental health makes it difficult to stick to a healthy weight or a diet. So as part of the group discussion, 2 out of 12 attendees expressed their GP was rude or abrupt, and 6 out of 12, 50%, felt their GP was prejudiced. They felt they didn't truly understand their mental health condition, and that one lady in particular said how their GP actually drove them to tears because they just told them, you need to exercise and go on a diet, without fully understanding their mental health condition and having a real conversation with them. Most of them agreed, all 12 agreed that GPs need to be fully trained in mental health, and the GPs were actually too quick to dispense medications rather than understand their psychological state. And they all actually agreed that the combination of medication, I've realised I've misspelled it there, mediation, I meant to say medication, and therapy was optimal to helping them to maintain a healthy weight. So what do we plan to do as part of the Weight on My Mind campaign? Well, based on that research, we're actually in the process of contacting all the GPs within the Borough of Hackney to determine whether overweight and obese patients receive a full psychological screening, rather than simply being told they need to exercise or go on a diet, to ensure that GPs fully understand their psychological condition, if they have one, and that they're actually signposted to relevant services within the borough, such as City and Hackney Mind or the City and Hackney Wellbeing Network, where they can get individual or group therapy. We actually plan to do some work with Peace of Mind, which is another mental health support group, actually later on today, to carry out further research. And in addition to contacting GPs, we're going to contact postnatal support units and community-based mental health support teams to determine whether overweight and obese service users are getting sufficient support to understand and better support their eating behaviours, and indeed whether they have support such as a nutritionist or dietitian in conjunction as well. And also we plan to go into the community, such as local libraries, banks, job centres. We've actually got a community fun day approaching in one of the estates this Saturday to actually promote the project and help further reduce social stigma surrounding that. And finally, the last campaign that we're currently working on is called Pedal for Pounds. And this is based upon the idea to get more people pedaling to lose weight. And it's based on research we've done thus far. We went to 3 roads within the Borough of Hackney. You can see the percentages there, we actually counted the number of slim compared to overweight and obese cyclists. The figures there are quite surprising. So despite Hackney Council actually putting a lot of energy into promoting cycling, they provide a free cycle training, £10 a month for cycle hire. Hackney Council also promote the Santander bikes, which are daily hire bikes from as little as £2. And Hackney Council have actually invested quite a lot of money into building more cycle lanes. Yet not enough people are cycling in the borough. Pedal for Pounds is an event which takes place on the 7th of November, where we aim to cycle around Hackney Downs. And the idea being is to empower people who are overweight or obese to cycle. And we're going to help promote that through the Hackney Cycling Campaign, who work very closely with Hackney Council.
Okay, so you've talked to us about the work that you're doing and the plans that you have in the future, and that's really great because you clearly have an ambitious program. We've had some questions come up that maybe we could take up, and a few other questions. I mean, first of all, James mentioned mental health. You said a great deal about mental health, but he wondered, what sort of mental health problems have you found out? Are they basic problems like depression and so on, or are they more complex problems like psychosis and schizophrenia? And how do these different problems impact upon the well-being of your community and your citizens when you're dealing with the problems of obesity?
Thus far, we've only undertaken research at City and Hackney Mind. We're planning to expand the research at the Peace of Mind Mental Health Support Group today, and through community-based research. But based on the research we have done thus far, we found depression, anxiety were listed by 6 out of 8 people that filled out our questionnaire at City and Hackney Mind. Some people, one person said about hearing voices. One of the other service users said about psychosis or split personality disorder. So depression and anxiety seems to be the most common factors. As I explained, five out of 8 suggested, all 8 said that yes, my mental health condition has some impact upon my food choices.
James asked another question, and you talked about the work you're doing in open spaces, and particularly with the gyms, the outdoor gyms. And he was saying, isn't that a problem though? Because outdoor gyms sort of attract attention. I mean, people are seen using them, and obese people may not go there because they don't want their problem to be exposed to the public. So in a way, outdoor gyms really isn't the solution, is it?
Possibly, yes. I'm not actually a Hackney resident. I live in Kent. But from what I've seen in my local park, where I live near Sevenoaks, we have a more basic outdoor gym, like the picture I showed you before, with equipment such as treadmills, cross trainers, chest press machines, which are easier to use. And you actually find a range of different people using them, not just people that are overweight, so not just people that are at a very advanced fitness level. What we found at London Field specifically, the outdoor gym only consisted of using pull-up bars, an exercise where you could use your own body weight. So I believe that if you had an outdoor gym, although it would be exposed, if the exercise was, more user-friendly, there is a possibility that people of a less advanced fitness level, people who are overweight or obese, may use it. Now, of course, the fact that the outdoor gym is exposed, the fact that people can see you exercising may deter some people. But at Hackney, does Hackney make you fat? We believe that there would be a higher prevalence of people who are overweight using the equipment. And this is one of the suggestions that we propose to Hackney Council, in addition to perhaps the fat-friendly exercise classes, the fitness buddy scheme, and a more varied exercise timetable. So it's not just this one solution per se, but all of these solutions together may help more overweight people to feel more empowered to use their local park.
when you started this project in the first place, I mean, how did you contact people? How did you, find the clientele you wanted? What methods did you use? How did people respond? I mean, were they enthusiastic to work with you, or did they say, look, this is none of your business, this is my lifestyle?
In terms of engaging with people within the community, that wasn't so difficult. The barrier that we faced was actually accessing venues, partners to work with to actually promote our project. I think we sent out the best part about 200 emails and over 100 telephone calls in terms of actually finding partners to work with, to have a stall, have a banner and actually promote our project. Some of the good partners that we've worked with include the Hackney Job Centre, all the libraries within Hackney, local banks. We've been invited to some community fun days. We've been invited to Homerton Hospital, and there we've actually spoke to people about our campaigns, as well as recruiting activists, volunteers for our project. The majority of the response from the general public has actually been quite positive, in that they can see that we're trying to do a campaign, a project that empowers people to take initiative of their own health, which helps to contribute to reversing the obesity epidemic, and actually gives people that sense of cohesion within the community, which makes community stronger by working together. Of course, there has been, I'm not sure if persecution is the right word, but we have found a minority of people who have stigmatised our projects, who have said perhaps overweight and obese people need to take initiative and take responsibility for their own eating behaviours. But on the whole, I'd say the response from the general public, whilst we've been doing the community outreach work, has been very positive.
But yeah, obviously you talked about the environment as well, and the environment is the fast food chains and the supermarkets. I mean, are you surprised that they didn't respond to you about the waste issue, for example? Because, I mean, there's a lot of good food there and good healthy food that could be used by people, but supermarkets are not too interested. They are in some areas, but I'm just wondering why you haven't got a response about that.
It's a good question. First of all, perhaps the supermarkets, or indeed the general managers that we contacted from the supermarkets, don't feel accountable, in that it wouldn't affect their reputation if they didn't respond. Perhaps as the project is still underway, it's not a project as well known as perhaps other leading causes or projects. I know, for example, when the Evening Standard contacted local supermarkets to do a similar campaign, and that actually received a lot of traction. That had a very big media campaign behind it. So I'm not surprised as such. It is a bit disappointing, and perhaps if you can work very closer with local media such as Hackney Gazette or local newspapers, we might actually have got more of a response from the local supermarkets.
I mean, have you heard of the whole thing called nudge economics? If you can nudge people into doing something rather than force people into doing something, that's really good. And supermarkets are using this by putting different products, just above eye level, because that nudges them to buy the product. So if you talk to supermarkets about nudging people into buying healthier foods in that way as well?
We haven't, but you've actually just given me a very good idea. So as part of our price campaign, yes, that's certainly something we can definitely incorporate. You're absolutely right. I believe that a lot of supermarkets, the way food is laid out, the fact, for example, if you go into a local supermarket, you'll find there's a lot of chocolates or confectionery right by the checkout. And that's deliberate to make people buy them. So, yeah, that's definitely an angle that we can look towards going forward.
And you mentioned with the groups that you work with, you live in Hackney, very diverse, multicultural area. Do you have to work differently with different cultural groups? Or do you look at them as a sort of homogenous group? They have a problem, obesity. I can deal with that. Or do you have to approach them rather more sensitively, depending where they come from?
The challenge when dealing with diverse groups such as the Turkish community or Bangladeshi community, often it involves having to have a translator on board. So this is a challenge that we faced. If, for example, you're dealing with the Bangladeshi community, let's say hypothetically, and you're trying to educate them about healthy eating, we have to appreciate that, for example, curry, a lot of rice, that the diet is quite calorific and energy dense. So rather than sort of dissuading them from eating foods that's actually part of their regular diet, it's about making more minor changes, such as having less oil, using brown rice instead of white rice, reducing portion sizes, having more vegetables at the expense of meat. I would actually like to do some work with the different cultures going forward. I think there's certainly scope to look at as a campaign. Does your culture impact upon your food choices and upon exercise? And I think that's actually a very good campaign we're going to have going forward.
Okay, and we're coming very close to the end now. So let me just ask you one final question. I mean, we have a lot of people, obviously, who would ask you, what's the impact of what you do? I mean, how do you measure it? Have you sort of fed that into your project, and how do you measure impact? And have you any evidence at the moment about how successful in terms of social impact your campaign has been?
We've actually kept tabs on the number of people we've engaged with. I think in the previous quarter, so for the last 3 months, we engaged with some 500 people just through community outreach and social media, through website, through people looking at our website, through people liking and viewing our Facebook page, Just Happy Make You Fat official Facebook page. In terms of our takeaway shop campaign, for example, we've evaluated the success by the number of people that turned up on the day. 11 people turned up on the day. We had our guest speakers there from Make Kits and Sugar Smart campaign, which further promoted the project as well. What we plan to do going forward as well, all the evidence that we're compiling as part of our campaigns, we're compiling this into a report and giving the solutions to Hackney Council. So come April next year, hopefully we're going to have a long, comprehensive report which they're going to take on board to help really overcome the barriers that people face in terms of making Hackney an obesogenic environment, because this very much is a user-led campaign where people develop their own campaigns to come up with their own solutions. So I believe it's actually a very positive campaign, and we are actually getting a lot of traction. A lot of people are getting involved now. Okay, well, thank you, Adam, for doing that. I mean, that was an interesting journey through what you're doing. We also heard what John had to say, and as I said, it's really important to hear, you know, how people feel, been through the program and have faced the problem. And he was very, very articulate and very eloquent on, and very courageous in telling us about his situation. So you're obviously doing a really great job, and you've got a really good program developed, and I hope we'll hear more about it as that program goes through. So thank you for joining us, and thank you for the 2 or 3 questions that have come up, because they've been very interesting as well. So thanks a lot, and we'll end this webinar now.